So thank you, Anne-Marie. And as one of our speakers today, what was one of your highlights from the session?
Well, one of the highlights for me was really, I think, getting to grips with this challenge of nostalgia and nursing and the way in which it lulls us into this comfort zone about the past, but in which, in fact, there isn't actually a comfort zone in the past, because that's a myth that it's really built around, but it has a very powerful pull for the public imagination and the fantasy of what nursing actually was, as much as what it might be in the present. So I think it's a fascinating position from which to critique some of the challenges around the demonisation of nursing today, which is what we see when journalists and the media are critiquing nursing education as being the root of all evil.
And in terms of the symposium, did you meet any new people who make any interesting contacts?
I did. I met a wonderful woman called Margaret Hannon, who's been working on building community assets in Fife, and I guess I warmed towards her because I'm actually from Kirkcaldy in Fife itself, so I was fascinated to hear about that work, and it's very much a variant of community development and really building a social capital in the area. Yeah. And she's been doing that for 3 years, and a lot of it, in fact, is really generated through patient stories and narratives. And in fact, in the last session we heard the plenary on integrated care with Mike Rowland and Jennifer Dixon, which I also thought was excellent. The story about the ramp and the wheelchair does sound as if it's about to become, J.K. Rowling 2, isn't it? Was actually from her session, and it's interesting the way, again, in terms of what captures the imagination, that story spread like wildfire in her organisation, and now I guess lots of people are going to be talking about the fixables, as Kathy Pope mentioned in that session as one of the questioners. The fixables are sometimes quite simple, and whilst we think about the critique of the research on integrated care, and it's there's very poor resolution in terms of definition, it's a moving target, it never has an opportunity to really take root and grow organically. Whilst all of those things have been said, I think to look for those very simple details, that's what's really going to make the difference. Although, having said that, some of those simple fixables are maybe not that easy to find. But the power of patient narrative, and particularly, I met someone else, Catherine Dale, who also raised a question in the symposium, but I met her through another colleague who in fact was presenting on the nostalgia stories. She was talking about the experience-based co-design method that was used for cancer care at Guy's and St Thomas's, and again, the compelling quality of those narratives is really generated by video clips. That was the point of convergence between clinicians and between patients, and where they could then start to really work together. So I think it then explodes the whole meaning of, so what is narrative, and the role of narrative in medicine and in healthcare more generally. What can we leverage from that helps us to create a sort of a rhetoric? I mean, it's really about persuading people and politicians and policymakers the value of health services research.